All right. Welcome to everybody. The Association for Neuropsychology Students and Trainees and the Education Advisory Committee of SCN or Division 40 of APA, we're excited to have you here for this webinar called The Path to Clinical Neuropsychology Specialty Doctoral Training and Preparation. And we hope to really, have this be a useful webinar for students who are in programs or hoping to pursue doctoral training in programs that don't necessarily have an exact neuropsychology path. And so this should be helpful for everyone here. We have four amazing presenters today. First, we have the chair of the Education Advisory Committee, Dr. Pamela Dean. We have the former chair of the Education Advisory Committee, Dr. Scott Sperling. We have Dr. Emily Trichu and Dr. David Kaufman, who are also from the Education Advisory Committee, and they will each be presenting on kind of different aspects of the path of becoming a neuropsychologist, and then we'll open it up for questions. So to kick us off, we're going to start with Dr. Sperling. And he is going to talk about the training and education in clinical neuropsychology and review the Houston Conference guidelines and taxonomy. And then we'll make our way through pathways through clinical training, the scholarly and research work of what that looks like, and professional involvement. All right, turning over to Dr. Sperling.
Okay, well, thank you, Emily, and welcome to everybody. Certainly, we're clearly in a world of Zoom, which means Zoom fatigue. So anytime that you have the space and the energy to join one of these sessions, it is certainly appreciated. I think it just goes to show you or it's a testament to the dedication that you have to the field and to commitment to really thinking about training and education in this specialty in a serious way. So welcome. Again, I'm Scott Sperling. I'm the former chair of the EAC, current chair of the American Psychological Association's Committee on Early Care Psychologists, and currently at the Cleveland Clinic in their Center for Neurological Restoration. As Emily said, I'm going to talk a little bit about the foundation here and review some of the sort of the building blocks of how we think about training and education within neuropsychology, referencing the Houston Conference guidelines, the skills and knowledge-based competencies that we are looking to develop as we move through our training. And then I'll talk about the clinical neuropsychology taxonomy as well. So next slide, please. Just a bit of history here. The field of neuropsychology you can trace back in decades, right? So if we go back to 1977, actually, we actually see the International Neuropsychological Society really developed a task force on education, on accreditation, credentialing, and neuropsychology. And this can really be linked to the first real formal attempt to say, we need to think about a standard way that we are training and developing our sort of future clinicians within the field. And that task force ultimately developed very specific guidelines that were eventually approved by APA Division 40, which wasn't actually in existence back in 1977 at the time. Those guidelines were then published. And this was all sort of the very early groundwork that led to what most of us really reference as, again, the bedrock for training and education in this specialty, which is the Houston Conference guidelines, which really were developed in 1977. So there's actually efforts going on right now to be rethinking those Houston Conference guidelines, given that they are several decades old and that the specialty and psychology really has evolved over that period of time. But as it stands right now, we're really looking at, that conference has really set forth how we think about training and education in the field. Next slide, please. So the Houston Conference guidelines, what are they? It really was the first description of integrated education and training in the specialty. And it really outlines some of the core features of what we're looking at in terms of how folks move the skills and knowledge needed to become a independent clinical neuropsychologist. The guidelines specify that training has to be scientist practitioner based. And really importantly, and I can't stress this enough, particularly for this group, the Houston Conference guidelines do not say that an individual has to develop particular competencies at a specific time or in a specific way. Quite the contrary. The guidelines really say that there's flexibility in how any one individual will develop their skills and knowledge over the course of their training. And it's well understood that some folks will develop certain competencies in their doctoral programs, either through their coursework or through their practica, and other individuals might develop those same competencies as they move through their internship or postdoctoral level. And all of that is completely acceptable. All right. So one thing just to really kind of hold in mind as you move through your career and you think about decisions related to your training and education is that while we want to be building a sort of a standard set of competencies, again, the how and when can vary, okay? The Houston Conference does, though, and again, also critical for us to be keeping in mind, it does specify that a full-time or the equivalent 2-year postdoctoral training in neuropsychology is required. Right, so some specialties in psychology sort of vary on this issue in terms of if you need a postdoc, if it has to be a full-time postdoc. But the field of clinical neuropsychology has really, again, a long time ago come to consensus and said that if you're going to practice in a specialty, given the sort of the advanced knowledge needed to do it well and to do it competently, the only way to develop that is through a 2-year postdoc. Okay, next slide. So just some basic background, I would certainly encourage everybody here to read the Houston Conference guidelines. They are not long, but they are still critically important. Just for an overview, what we're saying here is that there's basically a knowledge base, and that consists of a generic psychology core. Things you would be thinking of here are like biological bases of behavior or basic statistics, biology, foundations for the study of brain behavior relationships, things like functional neuroanatomy, and then foundations for the practice of neuropsychology, including aspects of intervention and assessment. Next slide, please. In addition to the knowledge, we also need to be developing skills, right? So this is the practical aspect of our training and education. And these skills encompass things including assessment, treatment and interventions, consultation, research, and teaching and supervision. All right, so these are all kind of in broad strokes the areas that we want to be thinking about as we move through our doctoral programs, internship and postdoc. We want to be building competencies within, again, these broad areas that are going to allow us to practice independently down the road. Next slide. The Houston Conference says essentially that the training begins at the doctoral level. So this is sort of another point I think that's worth keeping in mind. Again, the how and when can vary from individual, but that sort of that last semester of our doctoral program, and then say, hey, this is really the time where I really want to start developing, all of my competencies. It's really understood that, again, the development of your skills and knowledge are going to occur throughout the doctoral level, right through postdoc. So at that doctoral level, as you might imagine, it's really the foundation, right? It's the foundations in neuropsychology, and it's really the development of that basic generic psychology and clinical core. So we're setting, we're setting our feet underneath us for the advancement of knowledge down the road. Next slide, please. At the internship level, we're going to extend that training. It's important that this internship is completed in either an APA or a CPA accredited program. And just by definition, when that's the case, we realize that all training at the internship level, when it's accredited, it has to be generalized, right? So even though you can do some specialty training, you could spend psychology at the internship level. You can't do 100% at the internship because the requirements say there has to be generalized training at that stage. Okay, so internship is going to be, you're still going to be working towards the advancements of that knowledge you gained at your doctoral program, but you're also going to be rounding out the clinical skills and experience just in clinical psychology in a more general sense. Next slide. Now, at the doctoral level, it's sort of should go without, without saying, is that this is advanced education and training, right? That's the definition of a postdoc, where we are beginning really to formally specialize. Next slide. And yep, thank you. Animation's always fun when you're not the one pressing the button here. Sorry, Emily. Uh, some things to keep in mind when we're looking at the postdoc, right? So the Houston Conference really outlines that we're looking for a postdoc that has at least one board certified clinical neuropsychologist. Go ahead, next slide, or just if you just want to put them all up, that's fine too. Thanks. Great, thank you. Training at the postdoc also needs to occur at a fixed site, or at least at a formally affiliated and sort of geographically approximate training site, and there needs to be some on-site supervision. In the postdoc, there needs to be clinical service and training programs. You have to have access and basically interface with other specialties as well. So we don't want to be entirely isolated where it's sort of just you and your one neuropsychology supervisor. There needs to be some interactions with other medical residents and, ideally other residents in neuropsychology. And although the exact amount of time that an individual can spend both in the provision of clinical services, clinical research, or other scholarly activities can vary from a person to person, clearly the nature and really the function of the specialties, they get a significant amount of time with the, okay, next slide. So again, as you see here, so the Houston Conference, I just want to underscore, is really, again, it's setting up what is the process of training. It's training that starts at the doctoral level, moves through internship, and then postdoc. The competencies really define the expected outcomes of training. So as you heard me just talking about, Houston Conference references these competency areas, but since the Houston Conference was developed, decades ago, a lot more work has been done to really fine tune and really flesh out to a much more significant degree what are the particular competencies that any particular person who is going to be practicing as a clinical neuropsychologist needs to know. And as we'll kind of walk through, they'll change in terms of what competencies you need to develop both at the practicum level and then at the postdoctoral level. So next slide. So competencies can really be broken up into two broad categories. There are foundational competencies. And for neuropsychology, these are really these sort of cross-cutting competencies that are sort of common across different functional domains. And they're, you look at things like professionalism, ethics, scientific knowledge and methods, again, need to be worked on over time. And there are some documents here, we'll have references at the end of this slide where, I really would recommend that you go to both from the practicum and the postdoc to kind of pull up the very specific competencies that you would be looking at developing. These are, again, broad categories, but within each of these categories, there's specific knowledge and skills that you're going to be looking to develop as you move along through your training and education. So we have foundational competencies and then we have functional competencies. And the functional are really, they're domain specific. These are really the specific knowledge and skill-based things like assessment and intervention. And again, of course, under assessment, there's going to be a number of other very specific competencies that you're going to be working at developing as you move through your education. Okay, next slide. I show you this to say, just to kind of emphasize the point that it is a developmental process, and we all know that, right? So to be an expert and have all the knowledge and skills ready to practice independently as a clinical neuropsychologist, nor do we expect that of a first-year postdoc. But there are methods now too, and there's work that is being done by the professional organizations, ACN, that really not only outlines what the specific competencies are in the field, but it is also moving towards a more standardized process for your training supervisors to actually be able to objectively measure and the knowledge and skills and to do that in a very consistent fashion as well. So depending on where you're at in your training, you'd be expected to have different competencies developed at a particular time. And that would be helpful for you to know, and to be working with your supervisors on this, and have that sort of talk, both ahead of time in the beginning of your program and then as you move through, so that you're on the same page in terms of, where you're going, and what areas are your strengths and what areas are your weaknesses that you might need to further develop. Next slide. At the postdoc, things are similar, but just more advanced. So just like practicum, we've got foundational competencies and we've got functional competencies. Next slide. And again, I'm not going to walk through. I mean, there's a very long list. Again, go to the documents that we have and links at the end. But essentially here we see is that neuropsychology, just like other specialties, has a long list of sort of these broad areas in which we're going to be developing very specific knowledge base and skills. I highlight the first three because this is just the example of across all specialties, not just neuropsychology, but all specialties in psychology have to be able to demonstrate that they're teaching to those particular areas, this integration of science, ethics, and individual and cultural diversity. But certainly within neuropsychology, we go well beyond that as well. And we're looking at things like assessment, intervention, but also teaching, supervision, mentoring, consultation. These are all important aspects to becoming an independent clinical neuropsychologist. Okay, next slide. Next slide, please. Now I want to shift gears here a little bit. So we started off by talking about the Houston Conference guidelines and then about competencies, right? So we have the process of training and education, and then we have the outcomes, which are the competencies. But a big question, and I'll talk about this as will others today, is really, well, how do you choose programs, right? How do you make choices that are going to allow you to enter into a doctoral program, an internship, or a postdoc that gives you the opportunities to develop those particular competencies that we're saying are important and are essentially critical and necessary to become an independent neuropsychologist. One of the barriers, if you will, both within neuropsychology and really across specialties in psychology for a long time now, or sort of barriers or things that have made it more difficult for prospective students, I should say, to choose programs or compare different programs, has been the lack of consistency in language that is essentially used to sort of describe the training offerings that they have. What I mean by this is that historically, one program might say that we have a track in neuropsychology, or we have a major rotation, or we have this sort of major emphasis in neuropsychology. And essentially, there's no standard definition for what any of those terms mean. They're sort of made up and utilized by an individual training program. And what that means is it creates a lot of ambiguity, and you can't compare, one person's track might not be the same as another person's track. So that makes it very difficult, obviously, to compare programs over time. And unfortunately, what can happen is the students can move into a program thinking that they're going to get a particular type of training experience, and it might not actually be exactly what they expect. So about 12 years or so, at least now, there was a push within the American Psychological Association to really address this issue. And what was created was this taxonomy for education and training in professional health service specialties, which neuropsychology is one of the health service specialties. Next slide, please. And the goal here is to create language essentially that language that would set forth, what the sort of minimum level of training and education requirements would be at a particular stage of the training. So you see here on the left, and we'll talk about this, there's 4 levels of training opportunity, from exposure to experience, emphasis, and major area of study. And then there's the 4 stages broadly of education and training. You have the doctoral level, internships, postdocs, and then post-licensure experience. So every single specialty, again, neuropsychology was asked to come up with criteria that would say, for a neuropsychologist at the doctoral level, what would an exposure look like, the bare minimum, or what would a major area of study look like? So next slide. So a major area of study, as you imagine, it's sort of at the top of the totem pole here. It really describes the highest level of education and training offered by the specialty. Next slide. An emphasis offers a structured and still a fairly in-depth opportunity, experience, hands-on sort of direct clinical experience, oftentimes scholar experience as well within a particular specialty, but it's not as intensive as a major area of study. Next slide. Experience goes beyond the sort of exposure, but it's not, again, as intensive as you might get with an emphasis. So there's just less training time that you basically have, both usually clinically and from supervision standpoint, than you'd get at an emphasis or major area of study. And exposure, as you might imagine, it's a very limited experience, and it's just sort of kind of dipping your toes into the water. It's still a structured learning activity, but there's not a lot of time or training that is happening within the specialty. Okay, next slide. So for neuropsychology, I'm not going to walk through all this, but we have, as do all the other specialties, we have a taxonomy. It's a taxonomy for education, training, and clinical neuropsychology. And this is really important both for you out there who are prospective students, but also for those who are involved in training, at the staff level or training within training programs, because it really is critical that we make a better push, particularly from the programmatic side, to be developing our programs and developing essentially how we talk about our programs in a way that is consistent with the taxonomy to make it essentially more fair for prospective students. So you can see here just as some examples for clinical neuropsychology. If you're in a doctoral program, a major area of study would be a program that essentially offers more than 3 courses and at least 2, 3 or more courses, I should say, and 2 or more practicum, and a dissertation or an equivalent research project in the specialty. In contrast, if you bump down to say an experience, this would be a program that offers 1 or more courses and just 1 practicum. So importantly, when we talk about the taxonomy, I should stress this, we're really talking about the program, right? We're not talking about individuals, we're talking about what the program offers. The individuals can use that to help make choices about which programs that they look for, but again, the taxonomy is a description of the program offerings. One thing that you'll see here as well that I think is just important, if you look over just at the postdoctoral training program, the only thing that exists here is a major area of study. And that's because, again, if you go back to just the basics, right, you go back to the Houston Conference and how the specialty has always defined what we think is required in order to develop the necessary competencies to become a clinical neuropsychologist. It is a full-time 2-year postdoc. All right, so you can't do an emphasis, you can't do an exposure in clinical neuropsychology. If you're going to sort of follow what is sort of the consensus criteria from the specialty, and you're going to practice down the road as a clinical neuropsychologist in what we have agreed as sort of is a competent fashion, then that requires this 2-year postdoc, which would be a major area of study. Okay, next slide, please. So I just want to underscore too, because this can get a little bit confusing for folks. So again, I just want to say that taxonomy, it provides, the whole point of this is that it provides a consistent set of terms and definitions about training and education, and sets up sort of essentially a structure for which programs can not, though. It doesn't say that a program has to provide a particular level of training. And importantly, both for students out there, it doesn't have anything to do with determining the quality of a training program, nor does it say that any one student should be entering a program at a particular level of training. So again, that terminology is really helpful for understanding what training programs offer, so you know what you're getting yourself into. But going back to Houston Conference, there's still flexibility that you have in deciding, when and where you develop your competencies. So you do not have to necessarily have a major area of study across the board in order to, eventually come out and be a clinical neuropsychologist. I think that makes it easier because obviously if you're in a program, an internship, that offers a major area of study, you simply have more opportunity. You've got more structured training opportunities, both from a clinical, a scholarly, get that experience, but it's not mandated. Okay, next slide. And I just say, underscore here, maybe a pitch that I have was part of the process to really help to sort of develop and promote the taxonomies, but both for the students that are out there and for folks that again are in training, is to really think about adopting this terminology. I think that it matters because it provides more truth in advertising. It clarifies the opportunities for lifelong learning. It also helps the public essentially understand, when sort of the types and the intensity of the training experiences that professionals have once they're all said and done. Okay. And it's pretty easy to use. So again, if you're in training, you can simply, identify the specialties that you have. You think about neuropsychology and you just sort of look at your training offerings. How many courses do you have? How many practicums do you require? Certain amount of supervision or dissertation experience. And sort of assess where you are and where you want to be, and then update your brochures, your websites, and materials that are consistent with the language of the taxonomy. Okay, thank you. And then we'll turn things over to our esteemed EAC chair, Dr. Pamela Dean.
Thank you. So my name is Dr. Pamela Dean, and a little bit of background about myself. I serve on the Education Advisory Committee. I also serve on several other professional committees through the American Academy of Clinical Neuropsychology, including the Student Advisory Committee, which you'll hear a little bit more about later, and the International Neuropsychological Society. Clinically, I'm at the VA Puget Sound Healthcare System in Seattle. And academically, I'm appointed as an assistant professor at the University of Washington in the School of Medicine. So now that we've reviewed the expectations around education and training consistent with the Houston Conference guidelines and the competencies, we're going to take a dive to specifically talk about clinical training, particularly practicum training, and how this can prepare trainees for internship. Next slide. So there's different terminologies that are out there: practicum, externship, traineeship, clerkship. For the purposes of this talk, I'm going to be using just the term practicum. They all mean the same thing. So students and trainees are gaining foundation principles from book knowledge. And the purpose of the practicum is to then apply this knowledge to patients in the clinical setting under supervision. Practicum is essentially then an extension of your coursework. It begins during graduate school and it continues on through postdoc. And trainees' responsibility and learning complexity then often increases and shifts consistent with their skill level or skill development. So it's often approached in a developmental model, but that can also somewhat be determined by their supervisor and also the site. So some practicums might be more appropriate for, say, a first-year practicum student versus somebody who is gearing up for internship applications who's already had several practicum experiences. And not surprising, but the number of practicum experiences can then contribute to the overall level of intensity and training and experience in a particular field of study. So I think most people understand this now, but for those of you that are maybe new to neuropsychology, I think we have a few folks here that are thinking about applying to graduate school still. So being a neuropsychologist is more than just administering and scoring tests. It's really the science of brain behavior relationships, and our unique contribution is being able to take multiple data points from the clinical interview, the record review, which includes things like labs and brain imaging, understanding medications and their side effects and their usage, and certain health conditions, and then the test data. So lots of different data points, and then synthesizing this into our conceptualization against what the literature says to make sense of what's going on for a patient. It's kind of a mouthful, but it's because of this complexity and the relationships between things like psychology, psychiatry, medicine, neurology, that the training demands are so rigorous. So how do we define a practicum? So a single practicum is defined as an organized training experience that lasts the equivalent of an academic year with supervised neuropsychological training for at least 8 hours per week, with at least 50% of that time devoted to clinical neuropsychology services. And these include the range of things, including treatment and intervention of some kind, assessment, interviewing, report writing, case presentations, conceptualizations. We're going to break that down a little bit more as we go along. And at least 25% of this time, of the supervised time, is devoted to face-to-face patient contact and or client contact. So the range of clinical experiences can vary from patient population to the presenting problem that the person is being referred for, the length and purpose of the evaluation, the complexity of the case, the number of evaluations you may do in a given week, and the clinical setting. So for example, if you are doing brief inpatient evaluations, you may see more patients per week than somebody who's doing outpatient, more complex evaluations. Next slide, please. So as Dr. Sperling had mentioned this paper, I think it's a really good paper for both supervisors, training directors, and students to read and review. The American Academy of Clinical Neuropsychology Practicum Guidelines Work Group developed these guidelines for practicum training in clinical neuropsychology. And they develop these competencies, which you've already seen, and I'm going to show you again in just a moment, to help guide readiness at different pre-doctoral levels. So this was really the first paper of its kind and the first step to setting out clear guidelines for practicum expectations. Next slide, please. So again, we've seen this table before, and these competencies. It's good just to, for training directors, for supervisors, for mentors, and for trainees to be familiar with this, because you're going to hear a lot throughout this talk about the importance of self-reflection at where you're at. And at each next stage and level of training, what you know will be essentially challenged. Next slide, please. So it's important to start evaluating your program and the experiences you're having, because that can help you, your training director, and if you're working with a mentor, to plan out the types of practicums and experiences if you plan to go on this pathway through neuropsychology. So while programs may not consistently use the labeling of major area of study and emphasis, experience, exposure, et cetera, trainees can think about their doctoral experiences and which level of neuropsychology training best fits those experiences. So a lot of questions come up from trainees wondering if they're at a disadvantage if they're not coming from a doctoral program that has a defined neuropsychology track. And while this hasn't been researched per se, the number of graduate programs that offer clinical neuropsychology tracks is not necessarily the majority. The advantage is that the curriculum, including the clinical training, the research experiences, the overall professional mentorship, are likely a strong component of the program already. But non-track programs, they can be a little bit more variable from having solid curriculum, similar to a track program, or they may have few to no neuropsychology faculty or relationships with practicum sites, which can make it more challenging for trainees to forge this path and gain appropriate clinical training. And it's really the purpose of this talk is how do we seek out those experiences when your program doesn't have this really well defined already. So selecting practicum sites, really getting the lay of the land. This next part will be a discussion that will vary a bit depending on your doctoral program and what may or may not be in place. So the first question is, does your program have established relationships with practicum sites that offer clinical neuropsychology training? Assuming that the doctoral program has the sites already established, there are likely prerequisites outlined for their setting, which would help match students to a practicum site that offers the appropriate level of training for a student's given level of skill. If this doesn't exist in your program, then is the student supported by the program if they need to find their own placement? And we're going to talk about how we do that in a little bit. The next part is, what is the role of the practicum student and what are the experiences they will be getting at the site? Again, gaining experience in all aspects of the assessment in some way, though again, maybe at varying levels of responsibility and independence, will be important in gaining well-rounded training to prepare you for the next stage in your training pathway. What is the population? At the practicum level, it's probably best to get broad clinical experiences rather than focused experiences. Many students may have ideas about the populations that they're drawn to, and some may not realize what they really are into until they have a new experience and feel that fire being lit. So at this stage, broad experiences are really key for a number of different reasons. And finally, what is the focus of the experience? Trainees should be there to learn. rather than to be there to support the productivity of a supervisor. The purpose of the practicum is a learning experience. Next slide, please. So there are a lot of different training settings that a student can gain experience in during their training. And the type of setting that you gain these early experiences in will also likely map onto your approach to applying for internships. And again, we're going to talk about that in a little bit when we talk about fit and match. Next slide, please. Okay, so continuing on talking about how we select practicum sites. This is a pretty condensed version of the practicum competencies that Dr. Sperling already reviewed. There's both the foundational competencies that are relevant to all health service psychologists, but the characteristics within these competencies do change slightly as applies to different specialties. There's also the functional competencies that specifically reflect things applied in neuropsychology practice, like assessment, intervention, and consultation. And again, the Nelson paper goes in depth on what these look like. But again, it's helpful to think about this as you're evaluating these practicum sites, whether it's the student or the training director, just taking all of these and kind of thinking about how this fits in. Next slide, please. Depending on your level or the trainee's level in graduate school, the first year of practicum versus preparing for internship, the focus of the training may be a bit different. So it's important to have general psychology training as well as neuropsychology training, but there's no one size fits all in terms of how this looks. And internship sites and faculty often have different preferences for training backgrounds, including the balance of neuropsychology to general psychology experiences. So in planning practicums, in general, thinking about gaining skills in intervention and therapy, having broad age ranges of experiences. And some people only want pediatrics, some only want adult, some are lifespan. It's not necessarily a bad thing, but again, thinking about breadth and having some limited experience in an area that you may not otherwise go towards in your overall pathway, this can maybe open some opportunities later on. Thinking about having experiences in different settings and diagnostic groups. This includes psychological diagnostic groups as well as neurological diagnostic groups, having some type of couples or group experience, and also having psychological assessment experience, not just neuropsychological assessment experience. And then gaining training experiences with patients from diverse backgrounds, urban versus rural, different race and ethnicities, disability, et cetera. And then on the neuropsychology side, this can include, again, aspects of training in all parts of the clinical evaluation, from the record review, the clinical interview, test administration, test selection, battery interpretation and conceptualization, report writing, and if there's a possibility for intervention based on the report findings, and this can include things like feedbacks. Next slide, please. Trainees are also often wondering about which type of setting might be best for having practicum experiences, or if they didn't match to internship but had completed neuropsychology practicums, why is that? There was a survey in 2012 that was published by Ritchie and colleagues, and they surveyed programs that met Division 40 Houston Conference guidelines for specialty internship training in neuropsychology. And they asked supervisors to rank the importance of certain information of practicum and doctoral experiences, meaning the importance that supervisors placed on certain aspects of a candidate's internship application. So with regard to setting, the number one was having experience in a university-affiliated medical center, followed by a VA medical center. What this reflects is that if a trainee has the goal of applying to internships at an academic or VA setting, having practicum experiences that match this, as opposed to private practice or group practice, is desirable. But the fact remains that academic medical centers and VAs also tend to be among the most competitive sites for internship and postdoc. Therefore, if you're coming from a non-traditional graduate program or a program that doesn't have these aspects of training already clearly outlined, depending on your location, this may or may not be an option for you to gain training experiences. Next slide, please. I think that was supposed to be hidden. If you could, next slide. Thank you. Evaluating sites, continuing on, talking about clinical supervision. So an important aspect of evaluating a practicum site is the supervision that's going to be provided. The goal of supervision is to support the development of the clinical competencies, ensure the quality of supervision provided to ensure the quality of services that is provided to patients, and help with the professional pipeline for students entering the field. So this is, again, relevant for both students and training directors, particularly when trainees are coming from non-neuropsychology focused programs and may need to seek out experiences outside of their program. So APA guidelines indicate that a supervisor must have competencies in clinical neuropsychology, which is defined by their education background, their training, having completed an APA accredited doctoral program, an APA accredited pre-doctoral internship, and the completion of a 2-year postdoctoral fellowship in neuropsychology that's in compliance with Houston Conference guidelines. So while having board certification or a board certified supervisor is not a requirement, it can be the clearest evidence for a trainee or a director of training to know that the supervisor's credentials and practice has been vetted before a body of their peers. We're not going to go into that in this talk in particular, but those not familiar with the field of neuropsychology, it's important to also know that there are well-reputed boards like the ABAT. And there are also vanity boards, which have vastly different standards. So when we're thinking about the provision itself of supervision, it's important to know how supervision will be conducted. Is this going to be individual or group? Is it vertical, meaning that a trainee is receiving supervision from a trainee at a higher level, like a postdoc? Will it be scheduled or on the fly? With all of these, there can be some wiggle room, but at least some amount should be regularly scheduled and individual. And again, those are outlined a bit clearer in other places. And then what is the style of supervision? This can change also between sites and supervisors. So particularly at the practicum and internship levels, there's much closer supervision of trainees as they're developing their competencies. But this too generally is somewhat conducted in a graduated manner in order to allow trainees to increase their level of responsibility as they demonstrate certain skills and knowledge bases. Next slide. So what if your program doesn't have a neuropsychology practicum site? If your program supports you going outside of what is already set up, there are a few things to consider. So first, talk with your training director, your director of talk with your DCT at your program about your options if they don't have an established relationship with neuropsych sites. A big question to consider is your program supportive of you going outside of what is already established? If they are, trainees can work to identify a site or a person of interest. And again, this is when it can be really helpful to have a neuropsychology mentor, and Dr. Trichu will be discussing how to look for this a bit later. Once you have identified a site or a person of interest to work with, connecting the DCT so they can then complete the necessary paperwork. And this includes having a formal written agreement that outlines the policies and procedures in order to protect the trainee. The slides we've already covered can help the trainee and the director to evaluate the potential sites. For some trainees who want to pursue neuropsychology, when there are few resources available in your area, it's important to weigh your priorities. So how important is it to you to pursue this path? If there are no local options available, are you willing to travel to a site? And if you are, how far are you willing to go? And of course, respecting the boundaries of your doctoral program. So for myself, there weren't any academic medical sites near me, and I didn't match to internship my first year because that was a gap in my training. So I took an extra year and found a practicum site, but this meant that I ended up driving 3 hours round trip 3 days a week to gain the experiences that were in line with my goals to set me up for success. So when I applied to internships the next year, I was a more competitive applicant, and I did end up matching to my top choice. So it's really helpful to evaluate your priorities. Next slide, please. A lot of questions that have come up from trainees in the time of COVID include how training has been impacted, how students' face-to-face hours have been impacted. So the AACN Student Affairs Committee conducted an online survey of neuropsychology trainees to understand their concerns and issues that came up during the pandemic. Prior to the pandemic, there were not many trainees who had received formal training or didactics in providing clinical services via phone or video, and supervisors were often kind of figuring this out alongside trainees at the start of the pandemic. So as we've now been in this for over a year, and with the vaccine, clinics are now starting to experience a shift, and trainees are experiencing a shift. But this survey revealed that the three main concerns were loss of clinical hours, loss of supervision, and the possible negative impact on their professional future. The authors also outline possible solutions to these in the field for the field to consider. But it's important to know that this survey highlighted that nearly all trainees were impacted by the pandemic, and internship and postdoctoral programs, as well as training organizations, all recognized that there was this shift in clinical hours. Next slide, please. So as Dr. Sperling was talking about before, you can't necessarily evaluate a program based on it having a track in its terminology. However, there are some things to consider when it comes to internship applications for track and non-track programs. So, it's another one of the questions that we often receive about the advantages of track versus non-track or generalist internship programs and which is best. And it's not necessarily that one is track over non-track that will put you at an advantage for applying for postdocs. Rather, what is important is that you make sure that the internship experience meets Division 40 Houston Conference guidelines for being a major area of study, meaning that you're getting at least of your 50% of the time spent in clinical neuropsychology consistent with those guidelines. Tracks do in some ways have some obvious advantages in that everything is laid out, but there are really great non-track internship programs, and it's really up to the student to review the brochure, do your homework, even if it's a track site. Do your homework and make sure that the training is consistent with your goals. Next slide, please. So how do we talk about fit and goals versus experiences? So start having conversations with supervisors, training directors, and mentors about long-term goals, work setting, population, etc., and the current experiences to help you or help trainees to evaluate their fit for internship programs of interest. Mentors and training directors also can help trainees to be honest with their training experiences versus their needs versus their goals, because this can have an impact on the success they have during the internship application and match process. It's also important to have early conversations between the student and the training director to evaluate the training needs and feasibility of seeking out these experiences, particularly if it's outside the program's current structure. Because setting up practicum experiences to match overarching goals can help to increase the competitiveness of a candidate's internship application. So it's really important to have these conversations early on. And then prior to applying, reevaluate, reflect on the match between your experience, the site of interest, and the long-term goals. So for example, as I mentioned before, a candidate without academic, medical, or VA medical site training may be less competitive when applying to those sites for internships. Next slide, please. So part of clinical training is also having supplemental learning experiences. There are lots of courses that are available online and webinars that are available online that can also help fill some of that knowledge base. There's also other opportunities you may be able to seek out through grand rounds or brain cuttings. And then, as I said, seeking out some courses in neuroanatomy, clinical neurology, etc. Next slide, please. And if at first you don't succeed in the internship process, try again. Neuropsychology internships are highly competitive, even for applicants with strong training backgrounds. So reviewing site again, going back to what we were talking about before with that reflection, reviewing sites, reviewing your CV, reviewing and looking for any kinds of gaps. It may be necessary that a trainee needs to take an extra year to increase experiences to match the site of interest. And a couple things that you can think about during that year are defending your dissertation if it's not already been done, gain some additional clinical experiences to fill those gaps, and also publish or present research. And now I will turn it over to Dr. Kaufman.
All right, thank you. So I am an associate professor of psychology at St. Louis University, where we have a doctoral program in clinical psychology. And using taxonomy language, our concentration in neuropsychology fits somewhere between the level of emphasis and area of study, kind of depending on how you count courses. And it's a pleasure to be here with you. I've been an active member of the Education Advisory Committee for several years, and I'm currently finishing up a term as chair of the Publications and Communications Committee of SCN Division 40. Next slide. All right, so I'm going to be talking about research and scholarly work. And I think it goes without saying that a strong scientific education is one of the cornerstones of graduate school, especially for PhD programs. Now, a person could go through graduate school and could do a doctoral program in a PsyD program and have much less emphasis on scientific education and research. But certainly the norm and what is the majority of the case for people in grad school pursuing neuropsychology is that you're going to be in a PhD program. Now, it's important to note that the research and the scholarly work component of grad school expands quite a bit upon what people experience as undergraduate majors in psychology or related fields that would go on to pursue grad school. So the workload is going to be heavier. I think we would probably expect that, but it's worth commenting on. The projects and tasks that a person is involved with tend to be more complicated. And one of the real ultimate goals of research and scholarly work is that you're learning as a student and as a trainee how to produce original scientific work that's going to increase the knowledge base of neuropsychology and teach us something new. So again, there's obviously a heavier lift. Now, what should be pointed out, and this is not always immediately obvious to students entering graduate school, is that graduate students are going to be leaning very heavily on their research mentor throughout the process. The research mentor or advisor typically leads weekly individual or group research meetings with grad students. This is the person who's going to be the mentor of your thesis project, your dissertation research project. These people are teaching and advising and also advocating on your behalf as you progress through doctoral education. So these people really end up mattering a lot to your life, to your professionalism, to your training. And so you really want to be thinking heavily about there being a good fit between you and your advisor. This advisor is also going to be one of the people that's most likely going to be writing letters of recommendation, which may actually follow you throughout your career, right? So it's not just someone who's working with you in grad school. This is going to be a mentor. This is going to be a future colleague and a major source of support. So it just goes without saying from the outset, you really want to be carefully choosing not only your graduate program, but what kind of research advisor, who your advisor will be. And I'm just going to pause for a minute to put a quick plug into a book that some of you may have heard of, but for those who haven't, this is a book that just came out called Becoming a Neuropsychologist by John Ballone and Ryan Van Patten. Now, some of you may know John and Ryan as the two guys who founded the Navigating Neuropsychology podcast a couple of years ago. If you haven't checked that out, by the way, that's a great resource that sometimes talks about professional development and training issues like what we're talking about today. but also just does a great job of digging into the depths of neuropsychology. So this is a great book that could be a really valuable guide and resource to some of you out there. I just got my copy of it literally yesterday, and I was super excited because it's got great content that I'm really happy to share with my students and trainees. So definitely worth checking out if you haven't seen it yet. Next slide, please. Okay, so when we think about research and scholarly work, publications tend to be one of the most important things that people think about. And publishing scientific studies really is a critical and important way to advance your career. It's sort of, it's valuable. It's certainly a valuable process in and of itself. It represents the culmination of a lot of work. It represents, ideally, right, an expansion of the field of knowledge in neuropsychology. So publications are great. They're important. They're valuable. The other thing, though, is in professional training circles, they take on extra meaning because they demonstrate to the field, they demonstrate to future employers where you have been spending your time, right? What kinds of things you've been doing and what kind of capabilities you have. So it's a very important thing to be thinking about and to be trying to prioritize throughout training. In terms of thinking about this in graduate school, you want to start early and maybe even, again, think about some of these conversations but prior to grad school, right? Start early by discussing available projects with your advisor or with your mentors. Many students benefit from setting deadlines for themselves or getting help with deadlines from their advisor. You may also want to get help with writing goals or with, sort of organizational strategies, because the task of writing publications, depending on the project and depending on what your role is, can be quite demanding. It's different. It's multiple levels more complex than writing a good term paper for a course. As actually John and Ryan in their new book outline really well, I'm borrowing some of their terminology on this slide. There are two general strategies that students often take when working on research projects in graduate school. One is to take sort of a shotgun approach, which is where you just become involved in a wide variety of projects. You're working on different topics, you're likely working with different mentors, you're doing sort of a lot of things in a lot of directions. And while that is a popular and can be a very successful approach, it also comes with potential drawbacks. But what that approach often does is it can help to maximize the number of publications or research presentations that you get during grad school. So this can be very beneficial in that it is likely, certainly if the projects pan out and are successful, it is likely that you're going to be left at the end of this with more publications, certainly than you were when you started, and more publications than you might be if you take a different approach. Now, the other approach that John and Ryan outline in their book is this more of a sort of a laser focus approach. So if you build a depth of knowledge and experience in one particular area, oftentimes with one particular mentor, but again, it could be spread out across different labs or different individuals, slightly different directions, but it's very focused in contrast to the shotgun approach. Now, the laser focus approach works very well, especially if you're a student who comes into grad school very confident about your interests and in your abilities, and you sort of know, hey, I want to be focusing in my career on research of Alzheimer's disease or research in autism spectrum or some other clinical population or some other research methodology. If you have a lot of confidence, if you know what you like and you're very interested in building that depth of knowledge from the outset, then the laser focus approach way is going to work out well. However, your program has to have the resources available for that. So if you decide, I really want to build a career focusing on Alzheimer's research, your programs, your institutions of training are going to have to be able to facilitate that. It's going to be very difficult for you to build a focused area of research in an area that's not easily accessible or available. Next slide, please. So when thinking about planning for research, it's important to discuss with mentors in advance about the expectations of the project and what your role would be. So from the early stages of a project, you want to be keeping an eye out for how you can be as most directly involved as possible. And you want to be thinking ahead and planning as much ahead as you can about areas and ways of supporting your research. So keep an eye out for grant funding announcements from neuropsych related groups like the SCN, Society for Clinical Neuropsychology, annually has a dissertation award. The American Academy for Clinical Neuropsychology Foundation has a grant program, and they actually allow and even encourage grad students or other trainees to apply for those. You want to be clear up front about your level of responsibility on the project, both with you and with your mentor, right? So you want to be determining, is this a project where I'm going to be expected to be the first author, or an author for much further down the line with less responsibility? How will you contribute to the final product? Are you going to be writing a section of a paper? Are you going to be designing and implementing a particular part of a study? What is that going to look like? You want to be realistic about your time commitments. You want to look for projects with clearly defined endpoints, because your schedule in your various stages of training are going to have abrupt transitions and endpoints, whether it's in the doctoral program with just natural transitions through a thesis project, a preliminary exam, a dissertation, or whether you're in internship and postdoc experiences, which are even shorter in time than grad school. You want to recognize that some projects may not be a good fit. That might be because of the size of the project, the scope, or the risk, meaning that the project may not happen, or it may not pan out, or it may not be complete in a timely manner that really helps you, or that really works for your schedule. And you want to be willing and thinking about reaching out to productive research mentors, even if they are non-neuropsychologists, right? Seek mentors with good publication track records, particularly in an area that you are interested in studying. Seek out mentors with available projects that are appealing and of interest to you. And if possible, seek out mentors with grant funding support that might just help to increase the likelihood of success and possibly even compensate you for some of your time doing the research. Next slide, please. When also planning ahead and thinking about where research is ultimately going to take you, it's important to think about the venue of that. It doesn't always land in a publication in a journal. A lot of times, research that we're doing in different stages of training is building up to a conference presentation. So there are 4 of the most common neuropsychological association conferences that I've listed on this slide. So these include INS. The annual meeting for INS is in February. Now they have a mid-year meeting that is typically international in the summer, but the main meeting is in February, and the abstract deadline is usually in early August. I put this in here because you're going to want to be thinking about this, because not every project is likely to result in a publication, but you do want to be getting poster and conference presentation experiences. AACN has an annual meeting in June, and its abstract deadline is usually in January. The APA convention, which is where SCN and APA Division 40 obviously have their annual meeting, that takes place in early August, usually with an abstract deadline of December. And then NAN has a conference in October with an abstract deadline of February. So what you see with this is there is a bit of an annual cycle. It's almost seasonal, where you have different opportunities at different times of the year to plug into different conferences. Some of these have more emphasis on student presentations. So INS, SCN, those are potentially going to have different opportunities than a more professionally oriented conference like AACN and NAN might. But all of these organizations realize the value of promoting student research. So they are all going to have avenues, or at least there's going to be avenues you want to be looking at. You also want to look at non-neuropsychology conferences that may fill a research interest of yours. For example, maybe you're interested in developmental populations or dementia, and you can find related discipline conferences that might be a great fit. I would recommend that you want to aim to present research findings in one form or another once per year, if possible. Now with travel expenses, that can be hard to afford. And for some students, it might be that it's actually hard to narrow it down to just one of these conferences. So you can find students who are not presenting every year, but I think that that's in general a good goal to aim for. Posters are the most common format. When you're submitting an abstract during these abstract deadlines that I mentioned, you want to make sure that your data collection is complete. Your abstract will likely not be accepted at a conference if you say that you are collecting data and hope to have it done by the conference. That's not going to get you a seat at the table. You're going to need to be presenting an abstract on data that you have collected. And if you're at conferences, you want to take advantage of student-focused meetings and seminars. Don't hesitate to network. There's a lot of great learning and a lot of great collaborating that takes place at conferences. Next slide, please. All right, broadening the scope just briefly on scholarly work beyond publications or presentations. There are other areas of scholarly work that can be very valuable and very meaningful and very helpful to one's training and career. So you want to look at potentially student interest group publications. Getting involved with professional organizations is a great way of not only learning about the field and networking with peers and colleagues, but potentially having opportunities to be part of something that you are helping to generate new scholarly work or new information for others. Work with your mentor and your advisor to perform ad hoc peer reviews of articles for peer-reviewed journals. This is a valuable way to see the research process sort of behind the scenes and to learn more about what kind of factors go into getting a paper published versus what kind of factors might keep a paper from getting published. Look for opportunities. This could be local on your campus. This could be in your program for webinars, panel discussions, interviews, and possibly even program development or evaluation opportunities. Clinical databases can yield a lot of valuable research projects, but often take considerable time to create. So just be mindful again of the scope and the time commitment. In an age of having decreased opportunity to work with real participants, with social distancing and whatnot, you may want to consider using large publicly available databases such as ADNI, HRS, which is the Health and Retirement Study, or Safari, which is focused on autism. And you want to partner with other advanced trainees. Any form of research productivity is valuable, even if it's not closely related to neuropsychology, even if it's not what you want your career path to be, but try to find a connection between different projects. So when you're presenting your story in a job talk or in an interview, you can weave a coherent thread throughout your different experiences if possible. Next slide. All right, and so to sum up, tips for engaging in research would be start early, right? Diversify your efforts, plan and protect time for research in your regular schedule. Try to make this a regular part of your routine. Otherwise, it's going to be hard to fit in. And also pace yourself. Recognize that this is a marathon, not a sprint. You're not going to get publications in peer-reviewed journals overnight. This is going to take time and planning. And also evaluate for you as a person and as a trainee, how important is research for your career goals? Do you want research to be a big part of your focus, a big part of what you spend your time on? Or is this more a means to an end? It's something you want to focus on as much as you can in your learning and training, but in the end, you're feeling like you might really want to primarily be involved in clinical practice. Some internship programs value research involvement in publications more than others. And some, again, may value the strength of clinical training. So if you're making decisions about where to put your time, you want to be thinking a little bit about those long-term goals you have. And again, many neuropsychologists are more interested in clinical work than academics. So again, you have to just juggle these things. And you don't have to know all of this up front, but you do want to be reflecting on this to determine if the time spent in research and scholarly work is really going to propel your career and really enhance your training. And with that, I am going to turn it over to the next section and our esteemed colleague, Emily Trichu.
Hi there, everyone. My co-host, give me a thumbs up if you can hear me all right. Yeah, all right. I know, energy on a Friday afternoon, actually almost evening for many of you. My name's Emily Trichu. I consider myself to be a geriatric neuropsychologist. I actually get to work at the same facility as Dr. Dean at the VA Puget Sound, and I'm also an associate professor at the University of Washington in the Department of Psychiatry. And in the position I'm in the Geriatric Research Education Clinical Center, training is a huge component. However, the training is focused at the intern level and beyond, fellowship, as well as early career mentorship across departments and disciplines, MDs, Doctor of Nurse Practitioners, PhDs. I also really feel lucky to supervise and mentor both interns and postdocs in neuropsychology and geropsychology at both divisions of the VA Puget Sound. So that's the American Lake training program as well as the Seattle training program. So jumping in here, Emily, I apologize in advance that I swear I took the animations out of my slides, and yet I think they are still there. So for all of these slides, yeah, just bring it all up there because we want to move quickly through this last bit so that I can make sure y'all have your time for questions. So mentorship, what does it mean to you? How to define it? I think that there's many ways to do that, but I'd like to argue that a mentor is an individual with some sort of expertise that you've identified can help you develop professionally, maybe even sort of that professional personal balance as well in your life. They can serve often two primary functions, often career related, maybe like a coach of sorts, and also that psychosocial function, maybe a role model, maybe a support system. It's not easy getting through the long haul of neuropsychology training. What is mentorship not? I'd like to emphasize that being someone's mentee is not the same thing as being their protege. You do not need to turn into a replica of your advisor. It's also not necessarily the same thing as a supervisor. While a supervisor may become a mentor, watch out for having these dual relationships when you're on rotation with someone. They're probably likely judging your skill development on a clinical rotation or something like that. And you have to be aware that you need to fulfill certain expectations that may be different than what you would want from a supportive mentor. I think a good mentor is someone who will sponsor you. They're that person who, when they hear of a talk that they might have been asked to do, but they think you do a great job, they'll put you forward. They will share their wisdom. They're going to be accepting of you, the pros and the cons, and hopefully you can share those things, and also to provide some ethical and moral support. So really trying to assist with that professional identity development. They also need to be accessible. A really good mentor that you can't get a hold of ever, or that you don't have any regular connections with, is not necessarily going to serve that role as well. That last bullet point is really hitting on the fact that I found it interesting. You know, I jumped into my first job after postdoc, and all of a sudden I was supervising and mentoring, and I hadn't had any training in that. I maybe hadn't even had really very broad modeling of that. And those first experiences are formative. So as you're going along and you have mentors, I really recommend you take note of what really works for you and what doesn't. And different styles, so that you then will have those at your disposal when you get to be in this position as well. All right, next slide, please. And again, just bring them all up. So why mentorship? I'm just going to say, I think you folks most often need more than one mentor. It's really rare. There's not someone who's just that perfect person. I kind of thought that that was how it would go. My senior year in college, I wasn't quite sure my career path. This awesome woman came to speak in one of my learning and memory seminars, and just she talked, and I just, afterward I went up to her and I said, how did you get to be you? Right. And at the time, she was not yet the director of one of our national Alzheimer's centers, but she was on her way. So that's a really high role model. And she didn't have time to mentor me at each step along the way, but she definitely provided that first sense of, okay, here's my target. Here's where I'd like to be, the sort of position I would like to be in. So along the way, then I've pulled in different mentors for helping me build my teaching skills, my clinical skills, and all these other different facets that typically make one a well-rounded or even narrowly focused neuropsychologist. Let's see. So I'm not going to read over all of this. I do think it's important to know your own needs. I think we all sometimes have narratives about ourselves that we tell ourselves, and it may not always be quite how other people see us. And so having someone that you can be honest with and who will be honest with you is really helpful sometimes. I think I'm being confident in meetings, and someone nicely tells me in the background that actually I'm coming across as a little bossy, something like that. That was really good feedback to get at one point. And not that I needed to gender my way I acted in the meeting, but I really was overcompensating and trying to seem more knowledgeable than I needed to be. So that's kind of that piece there. Go ahead, next slide, please. Okay, so mentorship really is a dynamic engagement. This can be super short periods of time. It can be months, it can be years. And consider what form the mentor is coming in may sort of decide how long and for what period that mentorship may occur. I've thrown down some things here. What I realized I didn't include, I got great mentorship when I was in grad school from some of the fellows that had come from other institutions to my institution, and they gave me that perspective that was outside of the world I had yet existed in. And I look back and I really appreciate those folks. And a number of them are still, they're more peers now, but they're still providing mentorship in subtle ways. Think about the power dynamic. And that's also why I mentioned the postdoctoral fellows. The power dynamic can be pretty huge sometimes, and that's fine, right? That person with the big power dynamic, that's like that head of the Alzheimer's Center, they're the person who really can be your promoter, your sponsor, and introduce you to people at conferences, help you network. But I can't admit my failings so much to them, likely. On the other hand, having someone else in my life who's a closer mentor or a slightly different power dynamic gives me that opportunity to be a little bit more real. And that became particularly important at times in my career where I was trying to balance family and personal obligations, but didn't necessarily want to share that level of either health or family information with others. Next slide. I'm going to try to go fast here. Okay. These are just my quote unquote deep thoughts. You want to be proactive. Don't expect that mentors are going to come look you up. People are busy. And it's not until we often know that someone wants help that we feel like we could just offer it. And so it's okay to ask. This sounds silly, be eager. It shows that you're interested and you care. I think you can't force it though. There may be people who just for whatever reason, and it's not personal, don't have enough bandwidth at the time where you're looking for help from them. I do think that there's really no perfect fit. That's why I really suggest having more than one mentor. Let's see, don't stick with a bad match. I think that's a hard one. And it's much easier said than done. If you join a grad program and you're kind of assigned an advisor from the beginning, that may not always be the best fit. And for various reasons, you may need to keep that advisor, but that doesn't mean you can't seek additional mentorship. And there may be times where that is just, even that research advisor position is not going to work in the long run, and you may have to rethink your timing and direction. And that's okay. It's really all right to do that because time is a commodity, your life is a commodity, and you don't want to sacrifice everything just to force something to fit. I put say thanks here because it sounds silly, but it's a time commitment on both sides. And it's not exactly the sort of thing that a lot of your mentors there's no way to write it up in their CVs very easily, especially in certain less formal mentorship situations. So just a thanks is helpful. Taking notes, this is kind of like, you're not in their shoes now, but you will be soon enough. So pay attention to things that work for you and don't. The therapy hat, I say, is do have a sense of the boundaries. You don't want an advisor who's oversharing things with you that make you uncomfortable, like you have to help them solve their problems. And likewise, there may be certain challenges you're facing that don't quite fit in whatever that mentorship role you have set up as it is. Okay, next. Okay, so this is kind of that. These are relationships. I had a first mentor when I started my career who was assigned to me. That wasn't a great fit. It took me a couple of years to realize that I could like seek out a different point person and I didn't offend anyone. So do think about that. You might want to have a contract of sorts. That's sort of helpful. And I don't think you have to call it a contract, but you want to talk about how often does it make sense to meet? What is the focus? What's the driving reason for that connection that you've made? Okay, and then the next thing here, in terms of resources, that's okay. Emily, I just wanted to say that there's tons of different resources out there. Our education advisory committee has a mentorship, like a short-term sort of mentorship and advice kind of consultation, I guess I should call it. AACN has mentorship avenues. All these different groups can help set you up with mentors if you need to go outside your facility. Okay, next. Okay, so wow, I probably have no time for this, but just think about your curriculum vitae. It is course of life. That is what this is meant to be. It is not a resume. And so your resume, there's overlap, but the CV is not usually so much about skills, but about your experience and achievements. So I really just want to sum it up by saying, find examples of successful CVs. If you're applying to internship, look for that person who applied and got one of their top choices. There's a lot more than just your CV that goes into that. But if someone had a really bad CV, that probably didn't help them. Okay, next slide. I'm going to try to go fast. Okay, just think about what contents should be in there. These are sort of the basic headers. Depending where you are in your career, you may have more or less of these. Depending on whether you're required to have a certain format for your CV, you may be able to put some of these that you're stronger in higher up so that people will catch it earlier on. But typically there's a pretty prescribed order in there. Go ahead, next. Clarity. You want to make sure that if a page gets detached when they print it up, that they know what goes back together again. So make sure your name is on every page. Do not embellish. Folks that are reviewing CVs for internship and fellowship can smell from a mile away when someone's trying to like pad things or get flowery. You want to be specific and targeted. You want to keep it professional. I joke, no colored paper. That's kind of old school, right? Like you would buy pink paper or blue paper to print your CV on, but still think about what font you're using. Comic Sans is not going to be a good one, right? And also, I'll use APA style for references and citations. You want to be a psychologist, show that you know what the profession uses. And that cover letter. This is the place where you can let a little bit of you shine and catch them and don't and really engage your reader with what's special about you, because it is hard sometimes to have those features come out in the CV. All right, go ahead, next. Oh, no typos. Sorry, that last little thing. Definitely have others proofread your CV for typos. When you've gone over it and over it, it's really hard to catch those things. It's very normal to miss things, but you want it to be error-free. Also, this is just more of an aside. Everybody Googles everybody these days, right? They may pull up Facebook even. You never know what will pop up. So do have someone else Google you or look at your Facebook profile as someone who doesn't know you, and make sure that you're presenting yourself in a way that you're comfortable with. Okay, next. All right, so getting involved. I mean, this whole talk has been about getting involved in becoming a neuropsychologist, but do think about how being part of the neuropsychology community and being part of different professional societies can help bolster your networking, your name recognition, and just a chance also to learn more about what different avenues there are within our profession. So it also can give you the opportunity to develop leadership skills early on. That's sometimes an intangible that those who are reviewing your CV will see and give a real thumbs up to, because it says that you've known how to take on more independence and even help others get things done. So I know you all could read this. Let's go ahead and go to the next slide. Here are resources. I'm assuming the slides are going to be made available. These are all hyperlinks, but there's so many different groups and resources to get involved. There's another slide, go ahead. And more. And then our last slide that's coming up is some references that folks have mentioned. And with that, I am going to quickly stop talking so that we can get some questions and answers in. Thank you very much.
Thank you to everyone. I just am amazed at the breadth and depth of knowledge that you were able to jam pack into all of that. It's incredible. So thank you so much. Let me just add some spotlights so that we can do some questions. All right. I think everyone can stay just a couple minutes over. So if people have to leave at 5:30, no worries. But we did get many amazing questions from all of our participants. And so I do want to touch on some of these because I think some of this got touched on in the presentations, but others are worth kind of going over. So I'll kind of go through them in the phases of training, starting at the stage of applying for graduate school. And I think there's some just kind of basic questions that maybe you guys can help clarify. So first off, is there something called a clinical neuropsychology doctoral degree? And what is that?
Yeah, I can jump in. So no, there really isn't a doctoral degree that's unique or specific to neuropsychology. All neuropsych programs nowadays are going to be housed within clinical psychology doctoral programs. So again, as was very well articulated earlier, there's going to be different levels of emphasis and specialization in different doctoral programs, but the home program is going to be clinical psychology, and then neuropsychology is going to be a specialty area within that.
Great. And I think there's a lot of questions that have been touched on of, students are weighing the pros and cons of accepting offers or applying to different types of programs. PhD, PsyD, programs with tracks and not. And I know that you guys provided a lot of information, but if you could distill that down, what are kind of some main considerations of things that you would say are top priorities, things to stay away from, or how you would kind of go about figuring that out?
I can jump in first again. So I think, PhD versus PsyD is a pretty major difference in terms of the amount of time that you're going to be spending building up scientific understanding, scientific research skills. So for individuals who are interested in research and want that to be not only an active part of their degree, but potentially an active part of their career, you really want to be looking for PhD programs over PsyD. Now, for people who don't feel as interested in research and really want to focus more on clinical skill building, a PsyD program might be a great fit too. Sometimes people hear that distinction and they think that PsyD provides better clinical training than PhD. And I don't think that that's typically the case. It's just more of it, right? So it's more of an emphasis, more time, more hours. There's just less research balance. So don't make the mistake of thinking PhD programs aren't going to train you well clinically. That's not the case at all. But PsyD programs are not typically going to give you very much research foundation. So I think that's a big thing. I also just think, again, overall fit with research interests, with training interests. You can't start specializing in every possible way at the graduate school level. But if you know that you're going in and you want to work with kids and you're going into a grad program that has no opportunities to learn those skills, it's probably not going to be a great fit.
Such great
I thought I would
advice.
just say, I would say over the last decade, I've noticed some blurring a little sometimes between the PsyD and PhD programs. Maybe you all have noticed it too. I've seen some PsyD programs that have really strong research built in. It may be more qualitative research or doing more meta-analyses with existing data, but I think that important thing is to really think about the reputation of the program and talk to some people who did the program. I've been shocked that the occasionally what seem almost like predatory types of graduate programs that, you know, have you having to go out and find all your practica, or you have to go find, or it's a PhD, but you have to find a research advisor. There's no faculty that actually, they sort of give you a few names of people out in the community, but send you out on your own. So, and again, there's some go-getters out there for whom that just isn't that big of a deal, but do consider some of those aspects. And it's awkward to try to ask these questions of the programs themselves. So use message boards, use student groups, try to take advantage of those resources too.
And I think that comes back to, I know I feel bad because your section was rushed, but it's incredibly important for people to have a mentor and someone they're bouncing these decisions off of. That no applicant should be in a vacuum trying to figure out by themselves how to navigate this, and that you need to find people that you trust to navigate and kind of consume all this information that was presented in this webinar and available together. So thank you for that. One other kind of aspect of applying to graduate school that I think is worth touching on in a brief moment is, you know, terminal master's degrees and how useful can that be or a hindrance for people, and what advice does anyone have in terms of that? Maybe Dr. Kaufman can speak on this because he's
I
our
thought I would just
resident.
say really quickly,
Yeah.
my program didn't offer a terminal master's degree. In fact, there's not even one awarded along the way. And I really felt like I was disadvantaged. Like other people were getting to put masters on their CVs long before I was. But I also look back, I might have quit. I might not have made it. I might not have pushed through to the PhD if they had given me something along the way. So sorry, from my perspective, neat. But unless you just are going to do a position where a terminal master's is what's required, then it doesn't necessarily matter as much.
And I think just to
ahead.
clarify my questions for you, Dr. Kaufman, I think some students see getting a terminal master's outside of a clinical program as a path to making themselves more competitive to getting in a PhD program. So thoughts on that?
Yeah, so when we review applications to our grad program every year, it's a balance. There are some people who come in with master's degrees, terminal master's program degrees, and then there are people applying with bachelor's degrees. It honestly is tricky. Master's degree does not always help you. It's going to depend a lot on what the opportunities in the master's program were. But not all master's programs are necessarily going to have the same level of focus. I think that where I typically would recommend, if I was advising an undergraduate, where I would recommend looking at a terminal master's program is if you just haven't had enough experiences, or maybe you don't have quite the CV as Emily talked us through how to build that CV. If you don't have the CV to get into a doctoral level program yet, a terminal master's degree program might be worth your time, particularly if you just haven't had the coursework in psychology or you haven't demonstrated the scholarship in those courses. So I think there was a question in advance to this, and it's asked often, right? If I have a degree other than psychology at the undergrad level and I decide then I want to apply for a doctoral program in clinical psychology and then focus on neuropsychology, that's great, but how do I get in? Most graduate programs in clinical psychology are going to require that you have an undergraduate major in psychology or an equivalent of that. Now, that doesn't necessarily always mean the exact same number of credits, but if you majored in philosophy and didn't take any psychology classes, you're not going to be able to get into a doctoral level program. Like, it's just that simple. Maybe you could in philosophy, but not in psychology. So different programs at the doctoral level are going to have different requirements as to what kind of courses are required. It's not all universal, but I think it's typical that you're going to have, anywhere between maybe 18 to 25 or so credits. So you want to be thinking about, how can I get credits at a good institution? If I'm doing that at the master's level, then you want to be thinking about, again, a master's level that is housed in a department of psychology. For some grad programs, that's a huge thing. Counseling may or may not be housed in psychology. Mental health, if it's a master's program, may or may not be housed in psychology. So for a lot of clinical psychology doctoral programs are going to be looking for those psychology course credits. And there's a great comment in the chat, which is that don't forget about post-bac programs. That's absolutely the case, right? So you don't have to do a master's degree to go back and take additional courses to fill in that content. If you, like a lot of students, decided after your college degree, hey, I really want to go pursue this study. So those programs also are out there and available. I guess I'll also just say that as someone who deals with admissions every year in a doctoral program, it's extremely competitive, right? And so a master's program is valuable, but if you already have the coursework, if you've already demonstrated the knowledge base in your coursework, I would look at other opportunities. I would look at other ways of spending your time to try to enhance your training and make you stand out from the competition more, right? And that's not to say just anybody can go do a master's degree, but maybe there's something else that would be more valuable. So if you're really wanting to get more experience with neuropsychology, maybe look at a testing technician position at an academic medical center, look at a research position at an academic institution. Those may not give you a master's degree, but you can't do much with a master's degree anyway. So really look at the experiences if you've already got the coursework. If you don't have the coursework with the good grades, then look at a master's degree.
Great. Once students are in a program, but say that they're in a program that has less resources or less major emphasis of study or a track, I think the theme is lack of resources or limited resources. And you guys have certainly commented on a lot of strategies, but any other comments on creative approaches to filling in gaps in coursework or seeking out additional opportunities to create opportunities for oneself?
I can chime in on that one. I think, really it comes back to having good mentorship. And if you are coming from a program that doesn't have neuropsychology already established, reaching out to one of the different organizations that Dr. Trichu had spoken about, particularly the American Academy of Clinical Neuropsychology, the Student Advisory Committee Mentorship Program. So you can have somebody to work with that can help you kind of figure out what's in your area. How do I navigate this? How do I talk to my program director? As Dr. Duggan was saying, so you're not doing this in a vacuum because there's a lot of different moving pieces to consider if those aren't already well established or you're in an area in a region that doesn't have a lot of resources available to you. So I really can't underscore the importance of mentorship.
Can anyone comment? Thank you, Dr. Dean. Moving us forward, can anyone comment on, some programs are more pediatric or adult or lifespan focused, and sometimes students kind of change gears or decide that they need to go in a different direction. Are there ways that applicants can augment that or use the experiences they've had to kind of highlight transferable skills?
Yeah, absolutely. So first of all, there's nothing wrong with having some changes in the road, right? So there are far and few individuals who have had a very linear path to where they've gotten in their career stage. I think most of us have taken a very winding path, which keeps it interesting. So you don't have to know exactly what you're doing from the moment that you apply to doctoral, to your doctoral program. And it doesn't have to be written in stone. You're allowed to take new experiences, learn from them, and then sort of adapt your career, your education and training and your career trajectory based upon those experiences. So I think first and foremost, just saying that is not just acceptable, but it's completely normal. What you want to be able to do is simply speak to some common threads, right? And I think, as you just mentioned within the question, there are a lot of competencies, both knowledge and skill based, that are completely transferable from working within one particular sort of niche area to another. So if you just think about the working with pediatrics, not that I do this, but if you think about what a pediatric neuropsychologist might need to do, you're still conceptualizing the clinical data. You're working from an assessment standpoint. You have to understand neuroanatomy and the literature. All those broad domains are completely transferable to working with adults and older adults, right? So it's a different population of interest, and maybe some of the diagnoses or the diseases that you're working with are a bit more specific, but the general foundational skills that you're developing are really going to transfer across different specialty areas. And I would say the same is true for things like research. We often get questions where, a student might have a particular research opportunities, earlier in their doctoral career, and then they develop different interests as they go along, or they have different opportunities present to themselves as they move forward in their career, and they're sort of changing the genre of study, and that too is okay. If you are a good researcher, those foundational research skills are going to be, again, transferable regardless of what area you're studying. And if you can sit down with a training director on a clinical interview, or you can write a cover letter that just clearly outlines how you got from A to B, then I think you're going to be in really good shape.
Great. I think two last questions here. First, I think there's several questions that we got from people that more or less touch on the idea of, at the internship level, it's more important to ramp up at that time more exposure to neuropsychology experiences in preparation for postdoc, but you're still balancing the generalist training. At the same time, that is where things get extra competitive and it's hard to secure. And so many students face kind of going to a site that has more different experiences, but not as a heavy emphasis in neuropsychology. Any additional words of advice for students who find themselves in that position or hoping to secure a postdoctoral fellowship in neuropsychology?
I would say it's really important to have someone look over what you've done thus far. If you get a few people who tell you that your coursework and your number of practica in neuropsychology in grad school is really strong, then using internship to have a rotation that's not neuropsych is actually going to look good. But if you had a little harder time or less opportunities in grad school, then yeah, you want to gun for the hardest core neuropsych internship you can get, just speaking really bluntly.
And if students are already in a situation where they're facing this fall, they're going into a place that has some experiences, but not as many, what mindset should they be coming in and what should they be prioritizing as they're getting ready?
I think there's a lot of creative ways to get experience. And I think the bottom line, I think this is true from the earlier research studies that for, at the internship level that Dr. Dean showed, there's a study that is, hopefully coming out that we have for looking at what postdoctoral training directors are looking like, and it's fairly consistent with some of the earlier work. And experience matters, and experience in the specialty is what really matters, right? So the more experience you have in neuropsychology, that's what makes a difference. So if you're not getting that in the sort of the structured way within the program that you're at, there are a host of other things that you can do in terms of outside of experiences, educational and scholarly experiences, that you can still be developing your knowledge base and your competencies, even if it's not directly within the training program itself. And not only the benefit of sort of looking for those opportunities is not simply that you develop those competencies, which is clearly required, but then you can actually sit down again, going back, you sit down across the table from those training directors on your interviews, and you can be the individual that says, look, I was able to, accurately assess, with my mentors, what opportunities were available to me and which weren't within my particular program. And I realized that I didn't have opportunities X, Y, and Z. So this is what I did to go get them. This is how I rounded out my experience elsewhere. And then you're an individual who looks like you're proactive because you are, and you look like an individual who who takes seriously your education and training and shows a commitment to the field. So, those folks are going to be very highly
Yeah,
sought
when we
after.
review things,
I always
we
tell.
know that, we see that go-getters. Pam's personal story is pretty important. Don't get exactly what you want. You know what? Figure out what you got to do to get it, if that's what you want.
And also just being realistic, evaluating where you're coming from, where you want to go is really important, because if there's a huge mismatch, it's going to be a lot harder for you to get to where you want to be.
Absolutely. Thank you all so much. There's so many questions that we haven't been able to touch on, and I think some of those have to do with, later on in the postdoc leading to career stage, and so I think this will lead us to a future webinar on those sorts of topics. There's a few questions popping up in the chat, just asking for reminders about research mentors or advisors. So just a quick reminder that SEN, the Education Advisory Committee, they offer kind of consultations. Those are kind of one-time deal where you can kind of touch in on a short session to ask some questions and get directed to the proper resources. More information on that is getting updated soon, actually, on the website. So you can visit the website for more information of SEN EAC. Also, AACN, the Student Advisory Committee, has a mentorship program. And if you're seeking somebody who you want for a long-term, kind of longer mentorship, that is a great resource. Also, there are so many mentorship programs, we couldn't even fit them on all the slides, but Society for Black Neuropsychology, and, the Asian Neuropsychological Society, HNS, the Hispanic Neuropsychological Society, um,
The Queer
the
Neuropsychological Society, I got them all in there.
all of those, and also through kind of NIH mechanisms, National Neurology Foundation. There's lots and lots of avenues. So find multiple mentors that connect with you in those areas. And please, all students and trainees, be sure to be a member of SEN and join the Association for Neuropsychology Students and Trainees. We're the largest organization for students and trainees in North America. Being on our list means that you're getting emails constantly about all the best resources to be connected. And I think knowledge is power, and that's kind of the biggest thing. And I just can't believe, all these things that exist now that didn't even exist when I started my training not that long ago. And I think it's extremely helpful and important to stay connected. Thanks to everyone for their attendance, and we hope to see you next time. Thank you.